Hello everyone, and thank you for checking us out. This is SAC Health Answers, the program where we answer your question about health and provide you with the knowledge that you need for your health and wellness. I'm Dr. Jason Lohr. Many of you may know me as the CEO here at SAC Health, but I'm also a practicing family medicine physician. And today we have a question from Elena. And Elena asks, I have fibromyalgia and connective tissue disease. What do you recommend managing the pain and the stiffness without using pain medications? Let me start out by saying, first of all, I'm giving general medical advice and I'm not the personal doctor for you, Elena. And so as I give these words of advice, just be clear that they're general and that you still want to talk to your primary care physician specifically about any change in your regimen or what you're doing. And again, we're going to be focusing on very specific things that you can do other than medication, but there may still be the need for a medication. So again, run anything by your primary care doctor before you make any changes. When dealing with this double whammy of fibromyalgia plus a connective tissue disease, which could be a variety of things, including lupus or scleroderma or rheumatoid arthritis, we really have multiple tools in the toolkit that we can use in order to address these. The two things that we have to address is the first is central sensitization. That is the volume knob really being turned up on pain. So your sensitization, your sensitivity to pain, that knob being turned up. And then the second is the inflammation or the mechanical stiffness that can come from the connective tissue disease. So there really is two different things that we're addressing here. And it's with a 4-pillar approach that we're going to address this. The first thing is that for the connective tissue disease, stagnation will lead to stiffness. So we need to avoid stagnation. We need to lubricate those joints. So the secret here is really low impact and pacing. The first thing would be aquatic therapy. Aquatic therapy, if you have access to a warm pool, would be excellent. That pool, being in a pool setting allows you to take that pressure off the joints, right? It relieves that pressure because now you're floating in the pool. It's a lower impact area. The buoyancy will take the weight off of the joints, and that warmth will also soothe those tender points, especially those fibromyalgia tender points. So this is actually the gold standard, is to do the aquatic therapy. Number 2 would be Tai Chi. Studies show that Tai Chi reduces the fibromyalgia pain. And again, it involves very slow, deliberate motions, and those are really, really good for actually keeping that fascia sliding and gliding and really can help with the pain. And then number 3 is what we call the spoon theory of pacing. So don't go to the gym and spend 2 hours on a Monday and then don't go back for 3 more days, right? What we want to do is focus on exercise and moving those joints every day for at least 15 minutes. So it's that consistency and applying it on a regular basis every time. Second, if we're not going to be using any chemical pain relief, we really need to focus on things that can relieve the pain through interrupting signals that are traveling to the brain. And really, when we're talking about morning stiffness, heat is your best friend. The warm shower first thing in the morning, or applying a warm blanket to the body can really help to thaw the tissues. And we really want to save the ice for things that are acute redness, inflammation. And then a TENS unit. TENS stands for transcutaneous electrical nerve stimulation. And a TENS unit can be used, it actually helps to provide small little electrical signals to the muscle. And it really helps to kind of confuse the brain as you're applying those small signals so that the brain doesn't focus on the pain. Instead, it's focusing on these little signals, kind of overrides the brain so that the pain is not as present or consistent. The other thing would be like a myofascial release. So this is a specific type of massage, and this is not a deep tissue massage. This is a slow, steady massage. So it's very specific, and it really helps with both a fibromyalgia pain and connective tissue disease pain. Again, you really want to make sure you find someone who knows how to do this appropriate massage, because a deep tissue massage can actually worsen the pain of fibromyalgia. So third, we cannot ignore nutrition. Nutrition is super important, and I always talk to my patients about really an anti-inflammatory diet that can help to reduce the inflammation in the body, because we know inflammation is occurring when somebody has a connective tissue disease. So the first thing that we want to avoid is really sugar. Sugar is very inflammatory, and it's a major driver of inflammation in the body. The second would be things like magnesium. Magnesium, many people are deficient in magnesium, and increasing foods like pumpkin seeds, spinach, almonds, those are great sources of magnesium, and they can really help to improve not only the muscle spasms, but even the sleep quality at night. And then the other thing is omega-3s. Omega-3s come in things like walnuts and flax seeds and even fish oil. And so omega-3s really help, really like natural fire extinguishers for inflammation in the body. They're excellent to help decrease the inflammation. Finally, we have to talk about something we call fibro fog, and that is how fibromyalgia really impacts the nervous system. It really keeps the body in this fight or flight mode. And to lower the pain, we really have to switch to something we would call rest and digest. So sleep hygiene is so important here. I know we mentioned sleep just a little bit ago, but sleep hygiene is really non-negotiable. Poor sleep quality will increase pain sensitivity. So we really want to establish a rigid wind down routine in the evenings. So no screens, whether that's TV or even your phone, no screens an hour before bed. And we really want to keep the room cool at night as well. And then cognitive behavioral therapy, what we call CBT or mindfulness, this can really help the brain to not focus on the pain and really learn how to react to pain differently. So it's not something that just continues to spiral and eventually flare up. And then acupuncture. Many of my patients benefit from acupuncture and have used that in the past and currently, and it really helps the body's natural painkillers, which are endorphins, and it helps to increase the blood flow to the connective tissue. So to summarize, again, in our 4-pillar summary, number 1, move gently in warm water or with Tai Chi. Number 2, use heat for stiffness and TENS unit for pain distraction. Number 3, eat to lower inflammation, right? More omega-3s, less sugar. And number 4, prioritize sleep to calm the nervous system. You know, it's not about finding just one single magic bullet, right? It's about stacking up these small habits, and each of them can have a benefit. And as you stack them up, you can have even greater benefit. Great question, Elena. Thank you for that. I hope things work out for you. Thank you for joining us for this episode of SAC Health Answers. Your primary care doctor is your partner in your personal health and wellness. So for any questions you may have, connect with them, and hope to see you next time on our next episode of SAC Health Answers.